Mr. Governor, in Godwin
practice health system. This afternoon, I thought that the issues at hand are serious enough to disrupt your Sunday so that we can come and have a very honest and frank discussion. I've had the opportunity to sit in almost every morning in a meeting that has to do with our healthcare system. And it's become very obvious and clear to me that healthcare system, particularly the state healthcare system, has collapsed. I don't need any more evidence. I have taken time out. I have sent people discreetly across all aspects and all our healthcare facilities in the state. And so whatever I'm saying here today comes from a position of personal information. This is not hearsay. It is what I have seen myself, not only physical facilities, but with a broad spectrum of you practitioners in our healthcare system. The reason why I have come to discuss moving forward with you is that we have no other option. We have come to the end of the road. And I think this is the first time since 1984 that you'll be having a fundamental shift in the healthcare system in our state. I contested elections and I went across it. And it was clear to me as I went around that the people of the state Edo State spoke loud and clear that they want a change from the past. Because if not for the people, I will not have won the elections. So from that perspective, I have no fear, I have no inhibitions in making the changes that we need to make for the benefit of our people. I said we have come to the end of the road because moving forward, we have now introduced the compulsory health insurance scheme for all Edo citizens in Edo. And I cannot justify collecting premiums from people when I am not able to offer them healthcare services. I cannot. So we are making that fundamental shift from a thinking where healthcare was solely the domain of government to one where healthcare has now shifted to the individual. So the system and structure we operate has to change. We see the healthcare system in Edo as one. Because when you are sick, when you are ill, it doesn't matter where you get treatment from. It doesn't matter whether it's a federal facility. It doesn't matter whether it's a state facility. It doesn't matter whether it's a private facility. It doesn't matter whether it's a local government facility. The key for you is that I want treatment, I want to get well. So from that perspective, we will not discriminate. The health insurance scheme we've just introduced does not discriminate. Once you have your card, paid your premiums, anywhere you go in Edo State, you must be able to get service. That is the implication. That is why I said we have come to the end of the road of the old order. Moving forward, it cannot be as it used to be. What are the key features of the change? You have been discussing amongst yourselves. First, government will now focus on its key role in healthcare, which is to create policies and to regulate the healthcare system. So it doesn't matter whether you're a teaching hospital, you're a state government owned hospital, or a private hospital, or local government, that the standard you need to keep in Edo has to be the same and will be regulated by the ministry. The ministry does not have any business managing any hospital anymore. All our hospitals will now operate like any other hospital, like any private hospital, because the citizen has a choice of either coming to our hospital or going to spend his money in a private hospital. So our standards must be higher than that of private hospitals, because we have more money as government to invest in the healthcare system. We've seen it in education, where we have improved efficiency and parents are moving their children from private schools into government schools. Whereas that was not the case before we made that change. So moving forward, you have maybe 3 weeks to organize the system. I send people to Igara. There's one doctor in Igara, only one doctor. And how many doctors are sitting in specialist hospital Benin? How many? And what are they doing? We have tabs, we have compiled records of people who come in, they don't stay in our hospitals, and they go and work in their private settings. I have enough records. I can prosecute anybody I want to prosecute and get conviction, but I'm not going to go there. And please don't let me go there. We just must make our healthcare system work for our people. Between now and the end of the month, you have to commence the process of reorganizing. Because we've made decisions, we're not going to go back. I cannot go back and say, I will not collect insurance premiums. I cannot go and dissolve the health insurance company we have. We've started. I know you people have been working with the transformation team. Everybody must now account for what they do. There's no hiding space again for anybody. I know it's been the culture to cover up for people. You and the person you are covering up for, you will suffer the same fate. Because with technology, with the systems we're putting in place, we can account for everything you do. And you cannot argue that we do not pay. There has been no month on the 26th of any month that you have not received your remunerations. And I know some of you earn twice what I earn as a governor in terms of salary. But I don't quarrel about it. It's good, it's fair. But please work for it. Earn your pay. Provide healthcare services to our citizens. We refurbished a 300-bed isolation center for treatment of COVID patients, and it's been shut down. Meanwhile, UBTH is overcrowded. You find people on the corridors. Those people who go there, they are Edo citizens. They are one of us. They are taxpayers. But because we have failed to provide services for them, that is where they go and seek care. And those facilities there are overstretched. Ditto in Iroa. So I have sworn to my God that having given me the opportunity to come back, despite all the opposition from the old order, I will change the healthcare system in Edo State. It is nothing personal. I have nothing personal against anybody. But we have no more hiding room. You can't travel abroad to go and get healthcare treatment abroad anymore. People have not been able to. So we are stuck here. That means we must provide the care we go and seek abroad. Some of you live here and go abroad to work. It means you have the expertise. That expertise must now be utilized here if you decide to stay back at home. It is not a threat. It's just reality. The time has come where we have no choice. There's no other way except we all collectively say we want to commit class suicide, and we don't care. And you can see what's happening with COVID. It does not discriminate who. It could be you tomorrow. And if you need help, there will be no system, no structure. That your small clinic may not be able to take care of your requirements at that point in time. So, from just a humanistic standpoint, from the point of the oaths most of you have sworn to, I think it is only proper and fair that we all decide and join in this whole efforts to change the way our healthcare system has worked. We cannot go further with this. We have come to the end of the road of the old system, and we are now charting a new direction. So I've come here this afternoon to appeal to you to join us in moving in this direction. That is the purpose of this meeting this afternoon. I am not going to sit here to begin to talk about the details. I mean, I have had more than 100 hours. I mean, what am I talking? 100 sessions. Sometimes each session is almost 1.5 hours. Just listening to understand what happens in the healthcare system in this state. It is not that we don't have the people. Yes, we may not have enough. But the little we have, how are we utilizing it? It is not that we do not have the expertise. I have heard some young officers, I have heard some old professionals speak. I have seen their work. But the system suppresses them. I have seen corruption like I've never seen anywhere in the system, in the healthcare system. If I decide to charge some people to court, I will lock you up in jail for a long time. Because the records, and when you do these things sometimes, they're so clear, they're so obvious. And it's across the chain. The level of corruption in the health system in Edo State, is just unacceptable. It's like a basket. But like I said, it is not personal. I am not here to end anybody's career. I'm here to appeal to you to say, look, we have drawn the line. Going forward, it's a personal decision to join us to move forward. Or to say, you know what, I'll take a bow. On no account will anybody now refuse postings. On no account will you be asked to go and perform a function and you do it the way you like. No. Because that person, that client, has a choice of going somewhere else because he has already paid for his healthcare service. And all our facilities must now be manned. Permanent Secretary, you're going to sit and anyway, it's not something we'll discuss out here, but we will man all our facilities. Let me now see who wants to work and who doesn't want to work. So that is the purpose this afternoon. After here, we're going to go to Stella Obasanjo. I'm sure many of you haven't even been there to see what's going on there. And it is annoying. It's really, really annoying when people come to want to even assist and then you are trying to frustrate them. And it's top to bottom. It's top to bottom. So I'm just here this afternoon, like I said, to appeal to you. Don't think there's anything going on we do not know. Just doing things. We have enough information from whistleblowers, from people who do deals, people who feel cheated, people who feel oppressed. I have enough dossier. But I have said, maybe it was the old order that encouraged it, but now that we are shifting and we are changing, it's going to be that we will run a system that can survive us, a healthcare system that can sustain us. And by the grace of God, by the time we are finishing in 4 years' time, none of you will ever have need or cause to leave Edo State to say you're seeking for treatment, or anybody who is close to you is seeking for treatment outside of Edo State. On that note, I want to welcome you. It's like a mini town hall. We'll take a few questions, and I want to listen to the leaders in the system to tell me or throw some light on some of the key decisions that have been made and how we will go about with the implementation. On that note, I welcome you and say good afternoon.
Thank you, Mr. Governor. District, the SSG, the head of service, my colleagues. On behalf of the health sector, I want to first of all congratulate His Excellency for the overwhelming victory you had in the 2019 elections. I want to just highlight a few things. The achievements of the Edo State government in the health sector came in your first tenure and now the second tenure. The first
Yes, sir. Let's not go there at all.
Okay. Yes, sir.
Let's not go there. We should stop that nonsense. What we call achievements, then we're done for. Let's not patronize anybody of the system. Let's go to the hard facts. Why is it that we have only one doctor in Igara? How come we have less than 3 doctors in Auchi? How? Now there's a Lassa fever outbreak. There's a threatening what's it called? Cholera outbreak. We have COVID. Our people are dying. You know, nobody in this health system can give me data on mortality rates in Edo State. And you're telling me we have a system that's working? Please, it's either you guys take me seriously or the consequences will be really there. I've asked, in one of our sessions, we said, give us the record mortality in Edo, the people who have died. Are we not supposed to register deaths? Are we not the ones to certify when people die? Meanwhile, the records they gave us of all mortality in all the 34 hospitals in Edo State was less than what is recorded in UPTH in 1 month. Is that a healthcare system? Healthcare system. And this is the kind of attitude that causes it. We're patronizing ourselves when things are obviously bad. I have a pile. I know how many doctors, how many colleagues write to me every day for help. They want to go abroad to go and get treatment. If our own system was working, would they go out? Please, Permanent Secretary, don't go there. Let's focus on what's wrong and let's agree to begin to fix it. That hospital, on a monthly basis, their net income, their gross income is less than 500,000 naira. Meanwhile, in Igara there are nothing less than 20 hospitals. And you can go around and see what each hospital makes that don't have the facility we have in Igara. In Auchi, we make less than 2 million naira a month. There are private doctors in Auchi themselves that we know how much they make. So it's like, is it that we are deliberately killing our own so that other people can make it? Why? I need that explanation. I have all the data for each hospital, and I've done a survey around the area the hospital serves. So we cannot say it's because there's no clientele. It's because we don't have staff. Those are the things I want us to resolve.
Giving us today We've not had it before. The governor is not telling you that things are perfect from this end. This should have been an opportunity for all of you, the practitioners, those who work in our health system, to take up on some of the things you think or you expect. We have told you what we have observed. And we have said we ask you to come here to assist us to find a solution. So I expect that each and every one of you will have something to tell us as to what should be done so that we fix the health sector. I just thought I should intervene so that we understand the session better.
My name is Osumbo Osareme Augustine. By the grace of God, I am a consultant physician and a nephrologist. I had my specialty training at the University of Benin Teaching Hospital, and by privilege of grace, I had been trained in Hungary under the European Renal Association and the European Transplantation Association. I currently head the isolation center at the Stella Obasanjo Hospital Isolation Center. Now, before the COVID era, when His Excellency inaugurated the multi-level committee to handle the COVID-19 pandemic in March 2020, I was already a consultant nephrologist at the Central Hospital Benin and a practicing physician there. I want to start from there, sir, with your permission. Coming back from UBTH in 2016, I became the third consultant physician that Central Hospital Benin was having in a very long while. The current head of department of the Department of Internal Medicine had saddled that responsibility for a period of an average of 8 years before I qualified as a consultant physician and was appointed at the Central Hospital Benin. Now, not too long, I was made the head of department of the same Department of Medicine, Central Hospital Benin. Now, Your Excellency, please pardon me for these details. I am very sure that it will help us chart a good course forward, especially in the area of rendering specialist services to our own indigenes in the state. Now, like I said, I was appointed as the head of department, so it became very glaring to me the very many challenges that the Central Hospital Benin was faced with. Now, let me begin by saying that I took over medical wards, and currently the medical wards in the Central Hospital Benin for males accommodate a total of 30 beds, and on many occasions there could be spillover into other non-medical wards. What I mean by non-medical wards, I mean surgical wards, and sometimes even the surgical wards, orthopedic wards. And then for the female medical wards, that place currently has 12 beds. In total, the medical wards house or beds is about 42 bedded wards. And on very many occasions, there are spillovers of admissions because on the average every day in Central Hospital Benin, Department of Medicine, we have nothing less than 6 to 10 admissions in the medical wards. And like I said, many a times there are spillovers. And that is how we have managed while I was there. Now, because the medical ward has average of 6 units. The units, they include the medical wards, as I said.
Sorry, Dr. Gumbo, please, can you just go to the point? Are you saying, I mean, there are constraints in terms of bed space? Are you saying, I mean, I can't get where you're headed.
Yes,
right
sir.
now, you are managing the Stella Bassando Isolation Center.
Yes, sir.
Okay, and that is a 300, almost a 300 bed facility, right?
Yes, sir.
That you are shrinking to 100. So is it that people are not coming, or you don't have the space to admit them when they come, or what exactly is the issue?
Yes, sir.
In your same hospital complex, in Edo Specialist ESH, right?
Yes, sir.
You have how many bed facilities there? Right? You could argue in the past that okay, it's because people cannot pay, but right now we have both the healthcare provision fund and we have the health insurance, and I am saying that going forward we cannot accept the attitudes and the complaints you are making now. Going forward, the Edo Specialist Hospital is the minimum standard we will accept from any of our hospitals, and so everything has to be structured in that light. So the excuses we used to make in the past that this one cannot pay is no longer valid because provisions are now being made. So how do we run a first-class nephrology center in our hospitals? Edo Specialist Hospital, you know, they have a renal center there. Has that renal center failed one day? Has it?
Yes, sir. Thank you, sir. Sir, I was coming there, sir. I like I said, I run every Monday nephrology clinic at the Central Hospital Benin, and I have had many occasions to even help the Edo Specialist Hospital review their patients. The records are there, sir. Most of my patients who would need dialysis, I refer them there, and on many occasions I review those patients without being paid by of course I know I'm already a state employee, so without being paid, and the records are there, the doctors there, they will also attest to that fact, sir. Now, sir, let me be brief, because time will fail me to really give you the detailed statistics which are in my hands, and let me go straight to the COVID era, because that is where we are now, and it's because of the pandemic that the breakdown in the health sector is being unveiled right now, because I can say that it's not only even in the States, even in the developed countries, in the best of nations, there are evidences that there's already a breakdown in the health sector, overwhelming nature of the COVID infection, sir. Now, in the Stella Obasanjo Hospital, when I took over the headship there as the treatment center head, sir, in the first wave, we had a total of over 600 patients that were managed in Stella Obasanjo Hospital. 217 were confirmed. They were admitted, treated, and were discharged. The records are there, sir. They've over 400, sir.
In Edo State, how many cases were there?
That were there.
That simple.
Sir, in the first wave, we recorded 10.
In Edo State, how many cases?
In Edo State, sir.
Yes.
That's mortality, sir.
Yes.
Mortality in Edo State in the first wave was about a total of 110.
No, those are fatalities, but cases.
Total cases
Yes.
of confirmed
Yes.
COVID cases.
Yes, in Edo.
In the first wave, sir.
Yes.
In the first wave, there were roughly about 1,300, sir.
No, that is not true. We had in excess of 10,000 cases in Edo. So 600 is not 10% of what we had. They were all going to Euro and UBTH because nobody wanted to come to our hospitals. Meanwhile, we have how many hospitals we say we have? 34. So this is the point I'm making. We cannot cover up. We are not doing enough given the investments we have on ground today. Right? Let us just accept it. In fact, COVID did not affect us because people don't even come to us. They go elsewhere. So that's the point you just made. Of over 10,000 people who were infected by COVID, you only treated less than 1,000, less than 10%. Meanwhile, you are the main hospital. You have the main hospital system in Edo State. So the citizens have moved on. They don't come to us anymore. So what he's telling me is technically today, I can switch off Ministry of Health and our hospitals and move everybody else to private clinics and the teaching hospital, nothing will change. Because we are not having any impact on our people the way we should. If I close down the Ministry of Health and move some of you to this private hospital and give them money, nothing will change. Because the patients were not anyway, they were seeking care elsewhere. Because they don't have any faith and confidence in us anymore. So why 4 hospitals? If majority of our citizens don't impact them. I've just given you an example of Igara. I've given you examples of Auchi, where you have a general hospital, but most of the people there go to the private clinics. And the people we have sent to manage these hospitals there go move the patients to their private clinics. And we pay the salaries. We have a drug revolving fund. The medicines going to where they need to go to, they are never fully accounted for. We have all that data. Are you telling me you do not know? Because one thing I notice is that everybody covers up everybody. There is that silence, code of silence. Nobody must talk. I'm just taking your own now. Yes, 600 for one person, fantastic. But do you know how many patients went through UBTH? Do you know how many went through IROA? Do you know how many went through St. Philomena? Because the people don't have confidence in us, even isolation centers, they don't want to come, even go close to it. Once you say state government hospital, everybody backs away. Nobody wants to have anything to do with us. Because they have no faith in any of us. I saw a hand behind.
Mr. Godwin Obaseki. I'm also standing on existing protocol. I am Dr. Onsai Maxwell, and I'm in the Department of Family Medicine, Central Hospital, Benin City. I've listened to what you've said, sir, and I know that you are there for change. I just want to draw you to the challenges that has made it a bit difficult for probably some of the things you are saying right now. Sir, Central Hospital, as I'm talking about my department right now, on an average, a doctor will see 40 patients and above on a daily basis. That if you go to the outpatient department, they see an average of 3,000 to 4,000 patients monthly. But there are challenges. Most of the state hospitals is the poor among the poor in the society that patronize these hospitals. The services are provided in such a way that is affordable to the poor of the poor in the society. And I can tell you that in a facility where a patient card is 100 naira, as compared to UBTH, where a patient card is up to 2,000, 5,000, we may not get the kind of resources that you are looking at, because we looked at it as a public service. Now, looking at some of the challenges we've had, as been mentioned by a doctor in internal medicine, there is collapse of some wards, and that, of course, reduces the revenue that comes to government. Because right now, you cannot admit many patients because they have to pass through my department. But there are no bed space to admit them, so we have that challenge. Even when they are referred to ESH, They can't even afford the care there, so they don't go there. So they find themselves in private facilities where they can negotiate what will be paid with the private doctor. Now, on statistics that you mentioned earlier, I can confidently tell you today, sir, that most of the consulting rooms have no nurses. It is not doctors that write diagnosis on the register which will be presented to you for statistics. It's supposed to be the nurses. They don't have nurses. So most times, these statistics are missed, and not that they are not there. Presently, you were magnanimous enough to increase the number of nurses to, intern nurses to 80. But the challenge we have is that most of these nurses are temporary nurses who will just stay 1 year and leave the system. And so what we have now is that we have a lot of nurses that are being retired, no replacement. We are running a facility where a full ward, we have just one nurse managing 30 patients. Systems don't work like that, sir. In UBTH, on an average, in each shift, you are supposed to have 8 nurses managing the wards. But presently, we have 1 in each of the wards. Most of our patients are referred not to private facilities, but most times to ESH or UBTH because they are government facilities. That is how the referral is, sir. Unfortunately, they can find themselves in private facilities. We don't know how that happens, sir.
Dr. Rosai, listen, the good thing is I've been here long enough.
Yes.
A few years ago, I'll accept this argument. And you and I know more. These are, yes, for if who go in there to work, yes. I'm not saying some of the points you have not made are valid. But listen to your arguments. We cater to the poorest of the poor who cannot afford it. Therefore, we give them the type of service that they can afford with very almost subhuman service. Is that fair? Is that right? Should we continue that?
No, we shouldn't.
2, you argue that, okay, some of them, because of the quality, they then go to private clinics where they negotiate, right? So it means they can pay more because they value their lives. But they will not pay that to you. So you see the fallacy in that argument too. So it's not purely essential on an issue of payments, but the service, what they are getting for whatever they are paying. So the issue of payments, yes, maybe even if, let's assume you are correct, that used to be. But now, the federal government has a basic health care provision fund, at least to cater for the poorest of the poor. We've introduced health insurance. Should we now continue giving that quality of service and making that excuse? That's what I'm saying. Going forward, we can't. Because the people would take their own policy, their health insurance policy, they'll go to a private clinic and get care. This has been happening for years. Most of you have accepted it. Not because you're stupid, but because, you know what, that's how they want it. I'll collect my salary at the end of the month. I'll go and do what I need to do elsewhere with my skills and make extra money. That's what's going on. So the system is dead. We all know it's dead, but we all accept, it's alive. You talk about nurses. Have you taken time to look at the totality of your staff strength and see who is doing what and who is deployed and who is even here that is earning salary? Maybe you look at it from your own word. That one administrator has not done what they need to do. Do you know how many people in the payroll of the health system in this state that don't come to work? Could those people not pay for nurses? I agree, we may have an issue with nurses, and we are seeking accreditation for a nursing school, and we are reopening the nursing school in September. But moving forward, should we continue to accept the attitude and the habits currently existing in the healthcare system? That's the purpose. And we have to change now. Because since last month, we started deducting, at least for civil servants, their health insurance premiums. That's the point. We're not looking back. Because we can give all the excuses. Yes, some of them are valid, but you know that within the same complex, that Edo Specialist Hospital you're talking about, some of your clients still go there, right? You say they cannot pay. But I know how much we spend sometimes at the end of the month to offset debts of those who can't pay. The key is service. The key is quality of care. You talk about revenues. How much, at the end of every month, how much do you think all your hospitals make? And how much do you think we spend on a monthly basis? So we are not relying on the money you make to run the hospitals. So if you just got more efficient and be able to get more, provide better care and get people to pay slightly more, we're not going to be pulling back the subsidies we put in. But now we put everything and they take out everything. And not very little is given back to the patients. So these are the arguments you've made over the years. I've been here long enough to know it. I've sat down and I've gone through, if I show you my files on healthcare, last night I spent almost 2.5 hours walking through, looking at all the names, their qualifications, what they do. So it's not going to be easy to make these excuses moving forward. Because I've taken a special interest in our health system. Very special interest. And I'm looking at numbers, I'm doing the comparisons. It is not adding up. And it must now begin to add up. I mean, in terms of COVID, just your EOC, I know the efforts we put in to just get your laboratories and the laboratory attendants to be able to organize themselves to move samples. All sorts of excuses. So it's not only just up there, it's only downstairs. So I hear you. I'm not saying the point you are making are not valid, but I am saying going forward, it cannot work. It's not going to happen. It's good for us to switch off and let everybody go. And we don't have this thing. And we now look for money to give people to go and take care of themselves. Then that we have something that is not working. Oh, why? No, I just read with the system. I mean, your offices or the system you're operating. If you're not happy, how can you as a human being go to work every day in such a happy state and feel helpless? Huh? You know it's not good, you know it's not good, you don't like it, but you leave it. Yeah, so...
Okay. Thank you, sir.
Yes.
That attitudinal change is very important. But I also feel that most of these changes you are looking for, a lot of the doctors in HMB has to be co-opted into your plans. It is very important for the development of healthcare in Edo State, because once a lot of people are involved, it becomes more participatory than just instructions, and I think that will help in uplifting the healthcare in Edo State. Thank you, sir.
Yes, I've heard you. The society, the system we have today, COVID, has imposed certain requirements, certain changes. I'm not going to beg anybody to now begin to practice medicine the way it was taught to practice. I'm not going to carry you along to do what you are supposed to do. Is that clear? You swore to your Hippocratic oaths. You spent time going through medical school. You were taught to practice in a certain way. The way you are practicing today, is it the way you were taught? Then I should not carry you along to practice the way you were taught to practice, to do things the way you should do. Are you listening to yourself? I am not going to do that. I am not going to do that. I'm going to work with the association, and we are going to insist that the doctors give us the value we pay for. I mean, how can you tell me to carry you along to change the situation you are in. That is the problem. I should carry you along to organize yourselves better, to provide healthcare services to our people. But when you are practicing your own private clinics, I don't carry you along. Neither do you carry me. So this blackmail must stop. You can't blackmail the citizens of Edo, and again, I'm not going to accept it. Because just listening to those final comments is like blackmail. And we will not, the people of Edo will not accept it. Because we are already down anyway. We're not getting anything anyway. If sick come to you, we go to specialist, to UBTH or private. So it's either you want to step up or you step out. Like I said, I can shut down our hospitals today, take the money and give it to private or federal institutions to make a difference. In fact, people will be happier. If I take vouchers now and say, okay, I give everybody a certain amount for healthcare, go and look for healthcare somewhere. So there should be no blackmail. No, absolutely no blackmail. We have to fix it. I'm telling you, I am ready to put lifeline for this. Because it is worth, the healthcare of Edo people is worth dying for. If it's not worth dying for you, for me it's worth dying for. They are the ones who made me come to power. And I'll put everything God has given me to make sure we get this change. So if you like, follow me. I'm not going to carry you along. You should follow me. Is that clear? Yeah, or follow me to Stella Basanjo now, all of you.
And then, for those who require in-house positions, they will be taken to an outlet. But they will not come in from that service, they will come in from the back end. Which of them will show you the...
They are too busy. I will suffice for that purpose.
Just spread out a little. Just spread out some level of Stand back a little. Don't forward.
To follow me now, I'm not going to follow you. I'm not going to carry you along because you know where to go.
Yes, sir.
I'm giving you guys 1 week I know you've done your workshops, but you're going to do your workshops within 1 week to let me know how all our hospitals are going to be manned within the next 1 week. Postings to areas that are not served. The HR team is working with you. I want to account for every person. I want to understand what each and every one, particularly those above level 12, what they are doing in the ministry and in the board. Is that clear? For me, I have spoken with the permanent secretaries on the new structure, and they will begin to work. By March 1st, we know who is doing what, so that we know where the gaps are. Those who are going to the hospital company and those who are staying in the ministry. And the hospital company is going to be run like a hospital company. Because like I said, we now have health insurance, and people who are going to come to you will have paid for their health care. So that reorganization needs to be completed within 1 week. And then we'll then have another meeting, another workshop, internal workshop, to finalize that, so that by March 1st, we're going to be having a major health workshop in Edo State, right? Both virtual and physical, to explain to the world the new healthcare system that we now have in Edo, and all the structures the new structures in place. We're not going to achieve the level of efficiency we need from day one, but at least it's clear in our horizon what we need to do. I want the Edo Hospital Company to be more efficient than UBTH. It has to be. Because right now, we know, like I said, I have to make a decision. Do we put more money supporting you, or do we give the money to UBTH and IROA and St. Philomena? That's the choice we need to make. I need to put a certain amount of money in healthcare. The decision is, do we put it in our own system, or do we put it in, because at the end of the day, everybody will cater to Edo people. But I'm not going to put money in a basket. So if you guys don't fix our own system by the end of the month, I'll have to make a rational decision. Because at the end of the day, like I said, it's how many Edo people have access to quality care. That's what they care about. They don't care who provides it, whether it is state, it is private, it is federal government, because that's what they're dealing with now. Okay? We have lines, we have money ready to invest, but if the attitude is not right, I will not invest in this system. So you have 1 week to do all the internal work you need to do. We'll have a workshop, and then by the end of the month, we're good to go. Any questions? Thank you very much. Actually, Sean, the problem is those people don't do leadership. What are these students doing here?
I think that Kelly's comes to take them and refill.
But
So we
federal
have
government,
an arrangement with them.
they're giving us over 100 cylinders, I hope you know.
No, yes, I'm aware, sir.
The Kakovi.
Yeah, Kakovi. They said we should just tell them to go ahead and they will deliver it.
The one that went to the stage.
Just wait for them.
That's good. You think you want to move over there? Really go.
Давай так.
No, that one, no, I think that one is the person in the golden area within that other building, which is the external part of that building, that will still be in use alongside with that triaging area. So that was an officer working in that, only that segment.
So how many cylinders will this take?
This one will take four cylinders at any given time. And then when it gets into the main wall, it's now distributed.
So what was that doing now? You were just giving them cylinders.
Okay, fine. Right now what they are doing now is that, you see right there, see the new thing.
So that building is not piped to this central building?
It was, this one was piped. This one was
Initially, that was not. But after we finished, they will now extend to pipe this one.
Okay, so that's the pipe
Yes.
they're dug in. Okay. Well, how many you have? What do you have? Along within generation plant.
We have a plant. Our plant produces about 70 cylinders a day.
So you produce this.
We are producing. There are 6, 12. That will replicate, once they finish it, they will replicate that way. That can take up to 40 beds. So we are going to this same, so-called SOS.
You guys too.
No, we're not here.
I don't go that side. What's his name? This is a gallant guy like that kind of
No, of course.
We need it.
Oh, sorry.
So they want to.
You know the application will just be like this. That's why we apply for it. I have so many applications. I don't want to be connected to them.
No mic.
We are restructuring our healthcare system in Edo State, and we've been working on it for a while. Not just the Edo healthcare system, but quite a lot of our agencies. As you recall, we've introduced Edo Health Insurance, which means that citizens like you now contribute to a health pool, and with your card, you can go into any hospital in Edo State to obtain treatment. Being the largest providers of hospital services, it is important that we upgrade our hospital services to provide better care. Otherwise, citizens won't use the facilities. And in any case, we'll be shortchanging the citizens of Edo State. So I've given them 1 week to go and organize themselves to understand the things we need to do, policies, procedures, systems and structures we need to put in place to achieve the level of efficiency that we need to. We are making investments in hospital systems, we are making investments in our people. We are restarting the School of Midwifery and School of Nursing. The accreditation process is ongoing. So we're working to rebuild manpower, rebuild infrastructure, and to deliver quality service and quality care to our people.
On the bench, they didn't get to the deadline you've given them, or you were not satisfied with the feedback they gave. Are you going to insist on your demand?
Definitely. If we have option A, B, and C. If option A doesn't work, we'll switch over to option B and C. The good thing is that Edo is very well positioned. The healthcare industry here is fairly well developed, and so we're not short of many aspects of the chain like some other places. So it's something we must do, something we're committed to. So there's no choice. With COVID, nobody can travel out for care. We are all stuck here, so we have to make that.
And what about COVID-19, sir, in terms of this fast?
As you know, this is an isolation center we built, 300 bed. That was not being used. And with the surging cases, we're seeing quite a lot of cases in the tertiary hospitals and some other hospitals. We're here this evening to see the changes that we need to make, the adaptations that we need to make in this facility so that we can move more COVID patients in here. We just can't accept the high numbers of people who are infected and being treated on corridors because there are no more bed spaces in some of these other hospitals.
All right, thank you very much.